I'm Jodi Baglien. I'm a certified clinical aromatherapist. Where my work focuses is to bringing aromatherapy into healthcare. There's so many applications for it, not only for self-care, but for other caregivers and health professionals to bring it in as well. And so I really feel like I'm here as kind of a guide to help nurses and healthcare providers of all different types of backgrounds and approaches that want to bring essential oil therapy into what they do, and to help them define what those guidelines are. Not everybody wants to go through the entire certification process to become one themselves or have this level of experience. And so that's really where my heart is now, is helping especially nursing homes and hospitals and providing really clear staff education programs for them so that they don't have to figure all that out. They have enough to do. My job is to help them be the hero, give them what they need to do. So I really love that type of work. I have a studio here in Osseo, Minnesota, and I still do see my own clientele for aromatherapy consultations and some light aroma acupoint therapy, which is integrating my two skill sets, which is shiatsu therapy and Chinese medicine, and working on the meridians and the acupoints, along with essential oils, and the oils become the needle. So instead of massaging or using a needle to activate the points, I use my essential oils.
That's great. So Jodi, what is aromatherapy to you?
Oh, it's changed so much over the years. I see it as one of many powerful tools. I think there's a place for it, and where I've landed over all of my years of investigating, learning, I've continued to learn and explore all kinds of different aspects with aromatherapy. I think the number one thing that I always teach, if you're one leading benefit, if you do nothing else, play with stress reduction. Play there. Our nervous systems need relaxing. There's kind of a anxiety epidemic going on especially in our country. And so I just think I really love to promote the uses of aromatherapy for take a deep breath, take a time out, provide some space for your nervous system to relax. So one of the things I talk about is, do you have 5 minutes or just 5 breaths? Use aroma along with breathing, guided imagery. Find your happy place. What creates a feeling of bliss inside of you, and give yourself a break. Now, there's so many things you can do with aromatherapy. We can go from, wound care and bed sores and oral care for people going through cancer therapies and there's so many aspects of clinical aromatherapy that we can work with. Those are all powerful and important. But for the average person who just wants to, what can I do with aromatherapy? If you do nothing else, have it be part of how you take care of yourself, provide some comfort for yourself, comfort for others, and just enjoy the aromas.
As you got involved into the medical arena, into hospitals and nursing homes, how did you get pulled into it?
Well, people ask me that a lot. It's been, oh my goodness, I've been teaching in the community colleges for, maybe 15 years now through Normandale Community College. They have a fantastic integrative therapy continuing education group there. And so people know who I am, and many of the people I'm working with originally started their aromatherapy training with me many years ago, and then as health professionals, and then my information sparked them to go on and continue and get their own certifications done, and they're bringing it into healthcare, and then they wanted me to help with that. So it's relationships and just knowing, but my my focus with the hospitals especially was with the aromatherapy patch as a delivery system for aromatherapy. So when we work with the hospitals for the aromatherapy patches, it's such a clean and simple process for them to deliver essential oils in that way. And so it's really just kind of evolved. It's so new to them. They didn't know what to do with it, or how do you make this simple for them? Because that's the big thing. It needs to be simple, fast, and easy. They've got their hands full, right?
Sure. Is it more of the nurses or the nurses' assistants or the physicians? Who are the ones that are really seeking this sort of knowledge from you?
Definitely the nurses. And the nurses are the leads, and it is under their scope of practice. In the state of Minnesota, it's different in certain states, but here in Minnesota, they are hungry for just helping people feel better, to be the healers that they went into it for. And they're hungry for modalities that are finally being accepted. It's like they're the ones that can bring in all of the different wonderful things that are coming in now. It's care. They're so excited to be able to do this finally, and so they're definitely the champions, and they often have many skill sets themselves, and then they help direct the care and help we kind of look at it as like a train the trainer. They get involved, they make the decisions, they assess the individuals, the patients or residences for their are they allergic to things? Somebody needs to assess that person to make sure that aromatherapy is appropriate for them. So they are, and then the caregivers or the additional care providers that are there can deliver it and watch it, observe, or whatever.
So, in your experience, what's the biggest thing that nurses have said about implementing aromatherapy program in their practices?
I get the feedback that I get, because I'm a little removed from it in a way. It's kind of odd, they're the ones doing it. I remember one day an old friend of mine who works as a hospice nurse at a major local hospital. She took a picture of her badge and one of my aromatherapy patch packages and posted, "Thank you, Jodi, for making my day so much easier today." And the feedback that I hear is being able to provide somebody who is having a tough time just a moment of peace is one of my comments that I often make. I can't do anything else but provide somebody a moment of peace, connection to nature, just a chance to be encouraged to take a few deep breaths and relax. That's huge. And so a lot of times, especially if they're working with people that are agitated or prone to just a lot of behavior type things, it's something that person has they can be in control of themselves, and it gives that person some empowerment. And so that's the feedback that I get a lot from the nurses. One other thing that happens quite frequently now is a patient has received a patch in the hospital, and then they get out of the hospital and they want to continue to use them, and they'll contact me and they'll say, one, for example, I've had to have a lot of surgeries and I really react to the nausea medications, and I get very nauseated when I wake up from post-op. And she called and said, "I cannot tell you what that did for me to be able to not have to suffer through the medications that have an adverse effect for her, just did not work in her system." And she could smell our Queasy blend for the nausea, and that got her through. That was huge.